Hi, this is Ian Bostock, and I'm a master's student in Indiana State University in the athletic training program, and this is my internship reflection for a TTR 603 for summer internship class. This reflection is based on my evaluation of the location, preceptor, future references, and opportunities. For location, we were mostly in two spots, which was the football field, athletic training room, and the field itself, and then the main athletic training room on campus for treatments. Both had their strengths and weaknesses. The football field had enough tables to accommodate the entire team. We had enough treatment tables and taping tables, plus most things to use for patient care, for pre-practice and post-practice, just some ice, things like that, Band-Aids, things to accommodate players. It was nice. It was easy. They had enough. Everything there was ready for us to use. Everything was ready to go. We had enough supplies for practices. We had enough supplies for patients who needed things before and after practice. There wasn't a lot we were really missing, so it was nice. There was enough stuff. It was a good location. The main athletic training room was, of course, accessible. It had all the modalities we needed, all the therapy tools. So it was easy to treat patients there. There was a lot of stuff that we could use for our benefit and for the patient benefit as well. Weakness-wise, the only thing for location really was that it's off campus. The football field's 10 minutes from where I live. It's not a terrible drive. It's just if someone were to live 30, 40 minutes away, maybe even the other side of town, it's kind of an inconvenience. But besides that, there's really not a lot that was location-wise a weakness. Maybe a couple more modalities on the football field side of things, but besides that, though, not a lot of weaknesses. There was a lot of stuff in the athletic training room that was accessible. Parking's just kind of hard, so really that was the only thing there. Yeah, I didn't really have a lot of things negative to say about the location or where we were working. It was a really easy, accessible place in both circumstances when we were traveling from the football field to the athletic training room on campus. So it was a nice experience for location-wise. My preceptor, I guess I technically had 4. I had Sammy, Nick, Matt, and Shannon. Each one different in their own way of teaching and going about how they do treatments. It was nice having a variety of preceptors rather than just one. While it's okay to have one or you get one-on-one time, it's nice to have different clinical evaluation skills to learn from. It's nice to see how they go about things, learn from them, and getting different techniques, different experiences they've had with treatments. So learning why they use things in combination with others and why they don't use certain modalities with certain therapy like cryo or thermal. Besides this, it was just nice to see everyone. It's nice to get to know that we're going to have more than one preceptor, more than one person. It's nice to know that we'll have the opportunity to be with different people throughout the year. Weakness-wise, it's just kind of hard to communicate. And sometimes you kind of don't know who to talk to. You want to talk to someone about something, and then the next thing you know, you have to talk to someone else, and you've got issues with who you're talking to, and then you have to communicate with other people about your schedule. It wasn't the worst thing in the world. It was just day-to-day figuring out who's going to be where, if we were going to have different preceptors at different places, who's in, who's out, if we were trying to get to a hold of someone. It was just that kind of thing. Besides that, there was really no negative areas there. My personal preceptor is Sammy, so she's great so far. I've had no problems. She's wonderful. She teaches when we need it. She goes about everything that we need to know. She's been very helpful with scheduling. If we need to do something here or there, she's been helpful with communicating with us where we need to be, letting us go to do things that, while she sticks around and does things that we may have to do other times where we may have to be doing something, she would, take control and let us go while she does that. And it was super nice, super helpful. She's been great. Nick's great. Shannon's great. Nick and Matt have both been great, like I said. Matt's doing a great job first year, and Shannon continues to do a great job, and Nick's been doing great too. under a lot of the pressure they've had so far in the camp. For future students, suggestion-wise, just be prepared. I think there were times early on where I think I was going into this with a negative attitude with football. Just past experience I've heard about where people were, they're overworking you, you got to do this and that. And it wasn't like that for me. I didn't have that experience. I feel like everyone had an equal opportunity to do things. Everyone had the equal responsibility. So I think as a future student, don't go into things with negative attitudes is huge. Just enjoy it. You're going to get to work a couple opportunities throughout your years as an athletic training student. I've already had 2 different rotations. So this being my 3rd rotation and not having to change clinical sites is going to be super helpful. Not having to get accustomed to one thing and then going to another. So being at football, I know it's going to be a lot easier once the regular season starts. So I'm looking forward to regular season as well. Future student, just go with everything. Things are going to change. Things are going to happen where you're getting up. You have to get up early. You're going to have to go to bed maybe earlier than usual. You're not going to get to go out and hang out with friends. You just have to be prepared at all times. Make sure you're ready to go, because with football, everything changes. It changes quickly. People get hurt. People come in. Just be ready for nagging injuries. You have to be ready for patients they just may be sore, and you just have to treat that. As a clinician, you have to be prepared for just the small things to the big things. You may see something you've never seen before, and you have to discuss with a lot of people. You have to go about helping with injury reports sometimes. You have to be like, this is going to happen. If he can't go, he can't go. And they may ask you that if you've been treating that patient. So just be prepared for that as well. This clinical site did have a lot of opportunities. I dealt with 2 patients where one patient, of course, I discussed earlier, where I was helping before an ambulance arrived for EMS to transport. It was a case where we thought it was one thing, ended up being another. He got worse as things progressed, and that was a great opportunity. Just honestly, opportunity I wish I had was more on-field evaluations. I guess during the preseason, it's one of those things where you're not accustomed to the team yet, and it's probably better for GAs and the head athletic trainers that are here to probably go about those. But yeah, I'd like to do some more on-field evaluations here. It was one of those where there was a couple opportunities, and it feels like we weren't just it feels like sometimes we weren't even there to look or even observe while we were doing different things. And I think that there are times where we were more doing water work, and I understand hydration is important, but where we could do evals and instead we were doing, just waters and stuff, which I get is important for football, especially when it's hot. But I would like to see some more on-field evaluation, just some time with those, seeing if we can do patient stuff there. Besides that, I had plenty of opportunity in the clinic to work with patients. I had plenty of opportunity to talk and discuss my techniques and things that had happened that the day. But yeah, on-field evaluations, that's all I have that I'd like to see. And if we just, things like that happen, I get that it's probably best for head athletic trainers to look at those. So if things were to change, if we sit down and talk to presetters about that, that'd be awesome. But that's all I have, and thank you for watching.